So it gives me great pleasure to introduce Douglas Hiscock, Hiscock, who is a senior manager of SilverCloud. And SilverCloud provides digital therapies for mental health. I'm really interested to hear what Douglas has to say, because it's been really kind of building year on year in terms of the impact and the outcomes. And obviously we all know the level of need right now. So actually SilverCloud provides a really important solution to this very large problem. Douglas, over to you.
Hi. Almost a completely opposite end of the spectrum. I used to run an IAP service, and I looked at the budgets there and I thought, oh, could I have just a little bit more, please? It's quite a difference. So hello everyone, I'm Douglas Hiscock. My professional background is I'm a chartered occupational psychologist, and I've worked in the product team at Amwell looking after the SilverCloud platform. So I've worked in mental health for about 25 years, 10 years in IAPT, and have been, which has now been rebranded as NHS Talking Therapies. I suppose everyone's heard of NHS Talking Therapies, haven't you? So I don't have to go into all of that. I've worked in 5 years for SilverCloud, co-developing with the NHS programs and models of care so that we can deliver primary care mental health. So it's almost the opposite end of the psychiatric scale here. With the intention to reduce pressure on the clinical teams, it's a big endeavour, IAP was. I had to look after, I was responsible for about 8,000 people, and we had 100 therapists to do that work. So it's a big old thing to do. And also to support the long-term plan and the NHS long-term plan, when it was the 5-year plan and then the 10-year plan, and now it has no date. So I think everyone over the years, as this graphic shows, there's been an ever-increasing call for mental health services, so much so that it feels, especially if you read the media, that we're moving from an ongoing crisis to an ongoing crisis. However, having lived through, and I do see it as an expansion and a revolution in mental health. I'm old enough to remember the asylums and moving people out of the asylums, and then also about beginning that process of delivering community care. It does feel like that what we're seeing is the need that's always been there, that there is, as they say, that it's quite rightly, there is no health without mental health. With this in mind, I would say even to the 1 in 4, that graphic is underrepresentative. And in fact, in most lifetimes, we'll experience some point an unmanageable impact on our mental health. And that's just, this is the way it is, and we have to help people. As such, SilverCloud, our mission has been to help deliver what we consider to be the most important goal of the long-term plan, the parity of esteem between mental health and physical health, and that everyone should have access to mental health support, education and services at the point of demand. So making mental health absolutely part of the architecture of our health system. So, that's a lovely thing to say, but what have we been up to? It's very clear that this isn't just SilverCloud's achievements. We've worked really hard. We've pride ourselves at working with frontline staff to understand the needs of those patients. We go into services and we sit with them and understand what they're going through. And we've been at this a long time. It is interesting that we're still talking about a digital revolution. For IAP services and mental health services in the community, this happened almost 10 years ago. In fact, we grew out of a research endeavour at Trinity College in Dublin nearly 20 years ago, and we've been co-developing NHS internet-enabled CBT throughout that time. We're presently in nearly every single IAP service in the country, so there's a huge amount of digital innovation going on within these services. And we are a digital exemplar of transforming those things. So that's where we've got to, but how do we get there? Because I think sometimes it's always interesting to go back over the story and the things that we saw when we started doing this, and some of the very specific problems that IAP services had to overcome. The main one, and it is very true, that therapy is hard. It's a difficult thing to do. It is very hard to change behaviours and that are well entrenched, which in turn makes it hard for patients to engage. In fact, and in reflection, all of us struggle to change the way we manage our lives and to be the best version of ourselves. It's not an easy process. Therapy, as we know, is very structured and is very complex, and most people never fit into that 6 to 12 weekly sessions for an hour a week every week. So there's inherent problems within that structure. These engagement and structural problems have very large inefficiencies when you turn it into a big, huge service. And I think anyone here that's run a service knows that like a DNA rate of 10% is a really hard nut to crack, and it's very difficult to get people to come to that. So, from a SilverCloud point of view and a complete sense of delusion, we endeavoured to sort of try and alleviate and understand these insights and come up with some solutions. The first insight that was that of expectation and motivation, which rules everything in therapy. To give you an example, I worked in a service that thought it was digital, was really proud of its digital. We were very pleased with ourselves. We had a website, we had a form that everyone filled in, and lots of people kept filling it in. However, when we looked at the data, of those that filled in the digital form, 10% turned up. That those that rang the service and asked for an appointment, 90% turned up. And what we saw, and when we looked at this, is there is an expectation that if you offer a digital solution, it has to follow that digital path. You don't go onto a website, fill things in, and then wait for someone to call you, or then go into a clinic. You want it to happen there and then. So the first thing was if you choose to create a digital route, you had better give them a digital route. Give the people what they want so they can move through it. Another insight is that CBT is hard work. There's a lot of paper, there's a lot of booklets, there's a lot of tools. I don't think anyone here, I had to buy a franking machine to send all the posts out. Like, no one here knows what a franking machine is, like stamping things every day. So our admin team every day would send out loads of booklets and things to people. And the clinicians would pull around wheelie bags with all their paperwork in so they could have all of that with them. And then also, they then had to scan everything back into the system, so that it was a huge amount of time spending just doing all of that work. It was very inefficient. So digitalizing all of that stuff and putting it into the hands of the patient in their digital devices really was a game changer, with the clinicians able to see what people were doing and how they were progressing through the program, and also made it a massive important part of the session. So these people, which shifted the power from therapists saying, have you done the homework, to I've seen what you've been doing, and created that ability for people to change their behaviour. Lastly, and probably the most important insight, was the structure of therapy. Everyone gets offered sessions every week and for a defined period of time. And it's exactly the same no matter how you are as a person. Every week, the same session. And this causes a real structural problem. I'll give you one example. I had a phone call from a person who said, best service I've ever been to, really loved it, absolutely great, therapy was brilliant. Went out to speak to the therapist. The person had been spoken to for 10 minutes, and that was it, and the world had changed for them. From a KPI point of view, it was terrible, because it was something that we really wouldn't get benefit from with the way that the stats work, but it definitely became one of the case examples for the commissioners. But this is the issue that we had. So SilverCloud created the asynchronous methodology, which allows people, so there's no structured time to be seen, and you are allowed to make your way through the program. So the person is given access to the program, works at their own pace, and the clinician logs in and checks where they are, and then makes them go into the next stage of it. It allows the person to really go through the program at their own pace. If they're struggling, you can pull them back in and you can talk to them, but the structure of therapy doesn't get in the way of people making their way through it. So just to give you one example, we've now got a CYP program, and one of the clinicians said to us, this has managed to reduce the amount of time, clinical time with that patient, from 12 hours down to 2, and more importantly, the child didn't have to leave school to come into the clinic. So there are real examples of how just shifting that structure and changing the digital way we deliver stuff becomes a better process. So, with all this in mind, what have we learned? The thing for us is solutions have to take advantage of the big data that you start to create when you do these big services, and it must be scalable. Don't pick a thing to change that's going to have no impact. We've seen around about 1 million patients now come through our system, and we've had over 8 million interactions clinically with the patient. So we're able to see really quickly the kind of behaviours that are going on. And if then an inefficiency isn't felt by the service, it won't get used. The other bit, clinicians' time is very precious, and the integrated into the systems is really important. There has to be no cutting and pasting, and there definitely has to be systems that talk to each other. And this is really what I would say is the biggest stumbling block at the moment in most of this digital innovation, is the systems are still not playing nicely with each other, and there's still a lot of problems trying to get data across, as we saw this morning. And it has to be, and the world has changed a lot, but now it has to be on the person's mobile phone, and it has to be that extension, that person's inner world is really important. So I'll just give you a really quick personal example of how the world really does need to change. I recently went to an outpatient appointment. Very nice doctor, opened up their paper notes, started writing down how I'd got there, what I was there to do, and then asked me, without dropping a beat or anything, what medication had been given. And I said, oh, it's on the letter. He said, no, I need to know the medication of the company that's providing it. And said to me, the next time, can you bring the medication with me so that he can see what I'm being prescribed? It does seem a bit weird that we're still in a world where I don't have all of my information that I need from my GP on my phone to show people. And this was written into my notes in a pen. We have got to change the way we do some of these things. So, what are we doing now? So we've done loads of work in step 2 in the middle bit, just helping people deliver the online CBT. But as things have moved along, we've been pulled more into the more step 3 part of it, and we're just about to launch a program that's all about tools for therapy. So that when people get more complicated and have a higher level of acuity, they do need to be managed through the program a bit more. So the therapist can give a little bit of the protocol, and then the next bit and the next bit, that allows people to learn the tasks as they go along. And then they can do live sessions with people in the session and take them through the toolkits and all that kind of thing. The other thing that's happening to us as well is PCN's becoming quite a big thing. I was talking to someone earlier and it felt like IAPT had been rediscovered again. There's definitely in the PCN world is very much a real diversity of patients, from really acutely unwell people who are managing themselves in the community down to people who are just needing a well-being. So our program is beginning to be used in there to help people who just that kind of initial support on psychoeducation to enable them to make better ways of working, which is very good. So one of the things with this is enabling people to get the advice really early on, so that it prevents people going into A&E and reducing the amount of people going into crisis. And the thing that's in my head is that, going back to what you said earlier about smoking, we've just developed a smoking cessation program, which we think will work really well in the community and with people with complex needs, because they're not getting the advice where they need it. So just to give you an overview of the core principles that we have. The digital front door is really important. It is the point at which the person is the most motivated. They've just filled in a huge, great big form. That is the moment you need to capture them, and increasing the ability of someone to actually go onto something that's NHS nice guidance so that they can work through it is really important. You've got to create the feeling of not waiting. So people wait, like we have these waiting targets, but they're arbitrary to us. Like 6 weeks wait is like, we'll really congratulate ourselves because we've hit all our waiting list targets. But for the individual, that time is still waiting, and finding ways to give people information that's really supportive at that time is really important. being able to personalise the care, so like offering a holistic approach is really important. People have multiple problems and the psychological and physical issues that people presented with, and integrating long-term conditions with a psychological approach helps people transferring through the life cycle. With all of this, the offer has to enhance the provision to be interactive, integrated, and also interesting to keep engagement for both the clinician and the patient. Like we spend a huge amount of time working with clinicians to make sure your workflow does not mean that you don't use the program. It's all very well and good. We've got these apps that are really good for the patients, but it has to work for the clinician as well. And it has to go beyond the brief intervention. We get very little time with our patients to change things and help them. So being able to have access to this digital library afterwards is really important. So you're able to embed those changes. Next one. Okay. So, but one thing we learn again and again is what we have to undertake with services that performance. Have I gone too far? Yeah, sorry. Performance is everything. You have to understand your data, and you have to understand at the beginning, at the front end on onboarding, whether it's engaging, be able to see what's happening. Like we learned very quickly that people weren't engaging, and it really helped us change the way we're doing it. Within the progress, you need to know people are moving through the program, and again, we do a lot of work on making sure that services can see what's happening for forecasting, understanding the needs of people coming through so that you can build the right kind of support for people, and leveraging the insights to be innovative. There's always a better way of doing this, there's always a new way of doing it, and ensuring it's integrated into everything so that reporting can be really quick and easy, because otherwise you just don't know what's going on. Very conscious of time, sorry. Get carried away. So with this, this is our model. We really have a vision for the future of mental health and supporting the NHS long-term plan is to build that resilience in the system through integrations of the SilverCloud methodology into the centre of digital and physical health, ensuring that just as you need it, approach supports individuals and is at the core of what we do and what we build this into the whole system. This is our goal for the next stage of the long-term plan. As they say, well, we've changed it. No health without digital mental health, which is a new phrase I'm trying to get everyone to say. And then just lastly, and I think this is the bit for us which worries us slightly, we just want to mention a word on regulation and standards. We have worked really hard to have them all. Today it was announced that we're part of the new nice regulations for depression. That's great, and it really helps us to deliver the long-term plan, but we have to have the ability to innovate and to pivot, and it has to be done in a really safe but nimble way. So really just to say there's a load of innovation still to go, and we want to not make sure that we can do that for the next generation. Thank you. Thank you for listening.